Hello, everybody. Thank you for um, and thank you for joining us in our conversation. Before we get started, I first wanted to make some quick introductions and some acknowledgments. So I'm Abigail Silva. I'm an assistant professor at Loyola University, an epidemiologist, and a health equities researcher. I also co-lead CERCL, which stands for the COVID Equity Response Collaborative at Loyola. And Circle really is a team of public health, medicine, nursing, law, and social work students, and professors and staff who are working together in partnership with community leaders and public health officials to minimize the negative impact of COVID to our most vulnerable communities in suburban Cook County, in particular, West Suburban Cook County. So I will lead off our conversation tonight, which will be followed by at least 40 minutes of questions and answers with some of our experts that are here tonight. So let's talk about Dr. Young. She has expertise in pharmacy and has been actively engaged in
Suburban
work
County.
related to COVID
In
19
particular, West
inequities in education, resources, infection, and mortality. She comes out of the University of Illinois in Chicago. Dr. Amy Blair, she's a family doctor who treats patients in the Maywood area and has been the medical lead in CERCL related activities. Dr. J.B. Bertumen is infectious diseases physician who's also a recent graduate of the MPH program at Loyola University. And he's currently in his first year as an epidemic intelligence service officer at the Centers for Disease Control and Prevention. And currently he's assigned to the California Department of Public Health. And then there's finally Miss Gwen Smith-Harvey. She's our CERCL community liaison who offers her experience and insight on issues related to COVID and the vaccine. And Michael Romaine of the Village Free Press will go ahead and moderate that question and answer session of our conversation tonight. Now, before I move along, I want to acknowledge Loyola Medicine's COVID-19 Vaccine Community Advisory Council for their support, which is comprised of all of these institutions here. We also have the support of the Cook County Public Health Department and, of course, the Village Free Press. So tonight I would like to spend again the first 20 minutes providing you with an overview of where we are in the current pandemic with regards to cases and vaccination efforts, and also share with you information we know about the status of vaccinations for children, booster shots, and the variants for COVID-19. Again, most of the night will be reserved for questions and answers with our experts. So here are some of the most recent data for suburban Cook County. So as of today, actually, there have been over 280,000 COVID cases in suburban Cook County, as well as over 4,700 deaths due to COVID. And here on the lower left-hand side, you see the distribution by the different parts of suburban Cook County, with West Suburban Cook County having the most number of cases. On the right-hand side, you see a map of the distribution of cases with the darker blue designating the areas that have had the highest COVID cases rates per capita. And you could see some darker blues on the northwest side of suburban Cook County, but also around the Proviso area and the western suburbs of Cook County. So here we have the cases the case rates per by race, and you can see that the highest case rates are for our non-Hispanic Black communities as well as Latinx communities. And here on the right, you also see the distribution of cases or the rates for ages. And you can see that early on, actually in the pandemic, it was mostly impacting the older population, but now we see an actual movement towards COVID cases in the younger populations. And that's partly to due to opening up schools and going back to school. But here is also a nice narrative about where we've been in terms of the COVID cases. And you can see that the number of cases have been increasing and decreasing over time, with the biggest peak between last fall and winter, with a smaller peak in April, and then another more recent peak. But again, now you see that the cases are also going down again. So let's talk a little bit about the vaccination efforts in suburban Cook County. Already 1.5 million folks have received at least one dose of the vaccine. That represents about 67% of the population, which is great in a sense of reaching herd immunity against the coronavirus. And here are also some evidence that, again, vaccination is important because it helps curb the pandemic, right? So the line represents the number of cases over time. And you could see that they've been going down as the vaccination coverage, which is represented by the blue area, has been going up, right? So we know that vaccines work. Now I want to talk a little bit about COVID vaccination for children ages 5 to 12. So Pfizer recently submitted their pediatric data, and it was announced today that that they're submitting for approval to the United States Federal Drug Administration their data, so that it could be approved for use in young children ages 5 to 12. So their data includes information on nearly 2,300 participants who were given a 2-dose regimen of 10 micrograms each, which is less than has been given for adults. And according to the press release, the vaccine demonstrated a favorable safety profile and elicited a robust antibody response, and a response that was comparable to age population of 16 to 25. So again, the company intends to apply for emergency use authorization and submit that application widely for this particular age group. And Dr. Anthony Fauci has indicated that vaccines for this particular age group could potentially begin before November, and as early as possibly at the end of the month. So there's also been a recent recommendation for booster shots. If folks have had the Pfizer vaccine for at least 6 months, but it's also recommended right now, at least from the Centers for Disease Control and Prevention, for certain age groups, including those who are 65 and older and residents of long-term care facilities, those that are in younger age groups, but with underlying medical conditions that put them at higher negative risks if they have COVID. They also recommended for people ages 18 to 64 who are increased risk due to occupational exposures or institutional settings. And again, ask for you to talk to your provider and weigh the risks and benefits of a potential booster. Now, a lot of folks are also asking about a potential booster for the Johnson & Johnson or the Moderna. And today, Johnson & Johnson formalized their petition to obtain emergency use authorization to the FDA for the coronavirus booster shot. They're doing this in addition to the Moderna. And the FDA, the Federal Drug Administration, will meet and discuss this in the middle of the month. But the findings are also very favorable, but I'm sure our panelists will talk about that later today. Another important aspect of a pandemic that's worth mentioning are the variants. So the variants are really something that are monitored by the United States scientific community because they could be more harmful than the original coronavirus. The Delta variant is, for example, one of the more contagious than the original COVID-19. But there's other potential variants that are being again examined and looked and surveilled. But currently, right now, the most common circulating variant is the Delta variant. And we'll talk about that in a second here. So the Delta variant, again, is the primary one that's circulating, and it is essentially more contagious. The variant is, again, about 2 times more contagious than the previous variant. And some data suggests that the Delta variant might cause more severe illness than previous variants in the unvaccinated people. In fact, in 2 different studies from Canada and Scotland, patients who were infected with the Delta variant were more likely to be hospitalized than patients infected with the Alpha or the original virus that caused COVID-19. Even so, the vast majority of hospitalization and death caused by COVID are in unvaccinated people. So unvaccinated people remain the greatest concern, right? The greatest risk of transmission is among unvaccinated people who are much more likely to get infected and therefore transmit the virus. Fully vaccinated people can get COVID-19, but it's often considerably less than those who are unvaccinated. And people infected with the Delta variant, including fully vaccinated people with symptomatic breakthrough infections, can transmit the virus to others. And CDC is continually assessing data on whether fully vaccinated people without symptoms can transmit the virus. And then It's important to know that fully vaccinated people with the Delta variant do have breakthrough infections. They can spread it to others. However, it's also important to understand that vaccinated people appear to spread the virus for a shorter amount of time. So either way you look at that, it tells us that the vaccine is effective and helps us curb the transmission. So again, this is just a reminder that there is good news in all of this. We do have tools that offer us layers of protection against the virus. There are things that we can do as individuals, such as wearing our masks, still washing our hands, avoiding crowds. These are all things that we share responsibility as members of our community and our society. It's as important as getting tested and quarantining, so not to expose others. And of course, getting vaccinated to stop the spread of the virus. So with that, we'll start the question and answer period of our talk. And here are our experts, and I'll hand it over to Michael Romaine.
Thanks, Abigail. Appreciate it. Well, I would just ask if any experts had any perspectives on the some of the information that was presented by Abigail, and if you have any immediate thoughts that you'd like to include in no particular order before I ask a question that I had in particular. Okay.
I'll actually say something, actually.
Okay.
So I wanted to highlight one thing that Abigail had on that last slide, because it showed that, it's not just about vaccines, it's about like incorporating all types of measures to help prevent the spread of COVID. So, I mean, in addition to like the ongoing a promotion of vaccines. I mean, there's still the issue of masks, which I'm sure everybody is tired of by now. But I know that I'm in California right now, and what's happening right now is that people like indoors, even people who are vaccinated, are also having to wear masks at this point too, because I mean, as Abigail said, I mean, it's possible for it's still technically possible to transmit it, the infection, even if you are vaccinated. But really, what it comes down to is the important thing is that if you're still not vaccinated yet, then it's important that you do wear a mask in public, just because that will reduce the spread of COVID. So I wanted to highlight that just because, it's about like the different prevention measures, not just vaccination as well, though vaccination obviously is very important. And then probably another thing too is, I mean, one thing that I've noticed, I'm sure all of you have, is that there's still this push to find like alternative ways of treating COVID at this point. And one thing I wanted to address is, I'm sure all of you have heard about like the whole ivermectin issue right now. Like there's this push without much science behind it to get ivermectin if you're infected with COVID. It is a antiparasitic drug. It's not meant to treat viruses. So yeah, I mean, they've done like multiple studies with this, and there's really no evidence to show that it actually has an effect on improvement in COVID infection. So, what we encourage is like go where the science is, which is get vaccinated. And there is a couple of medications for COVID that are in the works, like from Pfizer. We'll have more data as that comes along. But yeah, I mean, I definitely would recommend against like looking for things that's like picking things off of social media and like trying them out if you're infected with COVID. So follow the advice of your doctors.
What? So Abigail mentioned, Dr. Silva had mentioned earlier about Pfizer's favorable safety profile, and I kind of just wanted to get a sense of what it means for a vaccine to have a favorable safety profile, and can you explain the process that goes into emergency authorization, because that's another point of confusion among people, particularly in our community, who may be vaccine hesitant because they feel that the government is rushing through the process, or they don't really know what emergency authorization is, and they confuse it with the drug that's just been rushed through.
I can take an initial stab, and I really thank you for bringing that up, because it's something I hear from a lot of patients in my office, is the fear that we don't know what really can go on with this vaccine because it was rushed. The first thing I start with is sort of the end of the story is that nearly 400 million people have received it now, and it's probably the most scrutinized, watched, tracked thing to ever happen in modern medicine. That, to have that many people simultaneously getting this vaccine, if there were something happening in a large number, we would have known about it. And two of the things that are written about for possible side effects still happen to the tune of 1 to 7 per million. And that, so those numbers are big, and they're sort of hard to wrap your brain around. But if we sort of just look at it from the big picture, that so many people receiving this vaccine, not having anything major come out, we would have heard about it, given that it's been highly watched. So there's that. And then on the historical end is that the technology of the mRNA vaccine didn't just start with this pandemic. So it was being utilized and tested on other viral infections before this. So the technology really was there. The DNA code of this virus, is what's different and new. But the vaccine went through all the proper stages of clinical trials that every other vaccine has done. And I think that nuance of the emergency use authorization has a lot more to do with just the timing, that things, as people have probably noticed in science, do not happen quickly. And so to go through FDA approval, everyone saw how long that took. This was a way to get the scientists access to be able to administer this in an emergency situation before all the committees had their normal procedures to meet.
I would like to add something to that, if I can. The first thing I want to point out, just as a pharmacist, is it's very important to be honest with people about the side effects, not the deadly side effects, because the deadly side effects are very rare. But other side effects that cause discomfort are quite common, and it's a risk-benefit analysis. So people should know. You don't want to lose people's trust by making them believe that nothing's going to happen if something minor is going to happen, because it's very fine to say you could feel uncomfortable for a few days. You could have to take Tylenol for a few days, but all of these things will resolve pretty readily and on their own. So it's just important to distinguish with people that those side effects that they're hearing about, these blood clots, this endocarditis, is extremely rare. And they don't have to associate that with the headache that their friend had for 3 days because they're disconnected. But I think also another thing about emergency use, I notice, is emergency use is given when the benefit clearly outweighs the risks. And the FDA ideally would always work this quickly. I mean, it would be a wonder for modern medicine if all drugs were approved as quickly and efficiently. So it's not that the situation is broken now, it's that it was broken then and that it's fixed in this scenario. But this is not the most polished vaccine yet. So of course, Pfizer is going to continue to study it. They're going to continue to improve it. They're going to continue to make the side effects more and more minimal over time, so that once everybody's getting the COVID vaccine, side effects are very rare, because Pfizer wants to make a lot of money in the future. And the best way to do that is to provide a vaccine that provides an experience that people don't regret ever. And that's what we think about with a lot of other vaccines. Most people, they may have felt a little something from the flu shot, but most people take the flu shot and forget. And certainly in the future, that's where this shot will go.
Another thing I wanted to add to the emergency use is that I can understand that people are hesitant about it because it's just happening so fast, and like usually this can like take years. But one thing to remember also is that this was a infection that had the eyes and hands of a lot of pharmaceutical companies all at once. So that meant a lot of a lot of research and information was being produced about it. I mean, ordinarily, like it would be like a couple of people that do tests like around the world that like last a lot of time, but because of the urgency of this particular pandemic, there was like so many tests that were going on, like and like big one and like with like large um like large groups. So I think that's something to remember too, is that the fact that it was fast doesn't mean that the data they were getting was not good. So that's something to remember too.
That's a very good point. I remember reading that and being struck by that. One of the reasons why they could bring it to market bring it to emergency use so quickly was because so many people had COVID. There were so many opportunities to test the effectiveness of it.
Mm-hmm. As opposed to like another vaccine preventable illness
Yeah.
like mumps, like where
Right.
it's hard to get like a lot of people that have mumps together, so
So does
at least not now.
does the large sample size and the massive amount of peer review mean that this could actually be safer than the flu vaccine?
Well, I
Considering
mean,
how many scientists worked on it and developed it all around the world, how many people were in the sample to pull?
well, and maybe Dr. Young knows more, but the side effect vaccine reporting system, which we have always had for the flu shot and all of those infections and vaccines, sorry, we also have a new separate system where people are registering their side effects in real time using applications on their phone. So I think you're right. I think it's actually probably the most measured vaccine side effect. Most measured side effects of a vaccine that we've ever had.
I would agree with that V-Safe app.
Yes.
I have noticed since December when I took my shot and I reported the side effects I had,
Yeah.
that the guidance for the shots has changed to reflect what is coming in.
Yep.
So it's definitely a responsive process, responsive to what people are reporting.
It's called V-Safe.
V as in vaccine.
Victor vaccine.
Okay.
Hyphen safe. Yeah.
Okay, V-Safe, and it's a phone app.
Yeah, you register. I was given the opportunity to register when I got vaccinated.
Okay, we have some questions on Facebook. One is from someone who said that, from what I understood about the vaccine, it's that whether vaccinated or not, Delta variant can spread rapidly. What would you say about those who wear masks, wash their hands, and socially distance and have not had COVID? How are those who never had COVID spreading it?
So
I can start off with that. So I think that's like what people have been kind of struggling with, is that like, well, if I don't feel sick, like why do I have to wear a mask? And the issue with it, and this has been true throughout the entire pandemic, is that asymptomatic infections, I'm assuming you're talking about people who haven't had COVID and are not like vaccinated, but even so, I mean, people the problem is that asymptomatic infections can happen in people, and it actually can be spread, and that's why we were like very adamant about people, even if you didn't feel sick, wearing masks in public. I mean, it would be nice if only people that felt symptoms could actually spread the virus and everybody else could not. But unfortunately, that wasn't the case with this. And so that's the reason, like, that's what I would say about that, is that sometimes you can spread COVID and not know that you even have the infection. In terms of other things like, like washing your hands and socially distancing, I mean, kind of going back to what Abigail's post, that slide that she had, like with the Swiss cheese, like going through it. I mean, these measures are not 100% perfect, unfortunately, and that's why we recommend so many at once, so that we can actually reduce transmission of COVID all the way down to zero. So, vaccination is great because, you get like 90% plus effectiveness with it. But, in those cases where the infection might actually break through, then you have masks and socially distancing to kind of deal with those other percentages.
Dr. Younge?
I just wanted to, first of all, thank Olivia Pope for her comment, and her Facebook post is very cute. I mean, her picture is very cute, but also to add that I think another thing is I would just want to commend people who are socially distancing and washing their hands and wearing their masks and have never had COVID. I appreciate those people for doing that. And I think it's important that we don't allow this conversation to descend into vaccinated versus unvaccinated, because that's not going to help us in the long run. But it is important to acknowledge that some people who even are vaccine hesitant are doing their very, very best to prevent COVID. But I think the question I have for those people is, how do you want to reemerge into society? If you want to continue to be completely socially isolated, be at home, never go back to the grocery store, only go to Instacart. If you want to continue to exist in that sphere, then you exist in a bubble of safety. But most people are wanting to get out. And that's the reason why vaccination has become the question of the day, is because people want to emerge from these socially distant spheres.
Another question on Facebook: can a person be reinfected over and over if you have COVID or the Delta variant once? If you can't get it again, why not? Or are you immune?
Want me to take a stab? So getting infected with one variant of COVID can give you temporary immunity. So 90 days would be what the CDC would say, is that for that time period, from the best research we can tell, you are very unlikely to get infected again. Now that's different with a different variant. While there might be some protection, a different variant is a different flavor to our immune system. So you can get COVID a second time. And that 90-day window is sort of the amount of time we know for sure that natural immunity from infection tends to last. Now, the exception to this is immunocompromised people. So we've learned a lot about immunocompromised people needing not actually, it's not considered a booster for them, but a third shot. They need to have 3 shots in order to get immunity. And that data and those studies also showed that they don't tend to get their own natural immune response from infection itself. So for anyone who is in that category, it would be very difficult to get an immune response to protect you for 90 days. I think you're muted, Michael.
Gwen. Can you hear me now?
Oh, we're both speaking.
Oh, I'm sorry. So the question from Facebook, another one, was if someone has so I'm sorry, Miss Smith-Harvey, did you have something else to add to that?
I wanted to ask Dr. Blair about, okay, so if you have someone that's been fully vaccinated within the household, say it's a grandmother, mother, and children in the household, those children have not been vaccinated, okay, and you are wearing a mask and washing and stuff like that, how likely is it for you to get infected by those younger children that's in the household that have not gotten vaccinated?
So a lot depends on the behavior of those younger children, right? So this kind of goes back to each individual of a household carries their own risk. If they are themselves the children of this grandmother, not our grandchildren, unvaccinated and going out, especially in indoor settings, unmasked, those would be high risk behaviors, to be indoors unmasked and then come back home. Even to a vaccinated person over 65, as we're learning, their immunity from the vaccine, if it's Pfizer for what we know so far, may be going down after 6 months. So if there's any way for that family to all be vaccinated, that's the ideal way. If there's not, then it really is back. We'll keep referencing that Swiss cheese model. It's just convincing all members of the family to do everything they can to do each of those measures to reduce risk.
So let's refer back to the children that are going back to school that are not vaccinated. So if they're going back to school and they're not in that category to get vaccinated, they're required some. And then I think in Illinois, all the children are required to wear masks, but some are not. But they still may, because they're going back to school, be able to bring that back.
That's right.
To the home.
Yeah. And I mean, that's why some schools have implemented surveillance testing. So some school districts will sort of get ahead of that by, identifying the asymptomatic cases among the children, and then quarantining the close contacts of those children. So each school sort of has a protocol like this, most guided by the local public health department, where, because we want the children in school, we put them in masks. They've done their spacing. Many have eliminated eating together. Then they're getting tested, and then they're getting quarantined if they're in close contact. Mm-hmm. So that sort of list is what's come about from doing every step of the Swiss cheese to reduce risk. And the last slice will be the approval of the vaccine for children age 5 to 11.
There's a Facebook question. Someone asked, is it safe to get the vaccine and the flu shot?
Yes.
At the same time?
Yes, it can happen at the same time. I think at one point there was like a 2-week window between the vaccines, but they can be given at the same time. So yeah, I think that's an important question. I think people for the last 2 years have forgotten about the flu. Actually, thankfully, I think the flu almost forgot about us at some point too, because with all the preventions that we did, flu numbers were way down as well. So, but it's still hanging around. It's been around forever. The last major pandemic was a flu. So yeah, I think that's very important to remember that there's still other things out there. So. That can hit hard, can hit vulnerable populations hard. So make sure you don't forget about the flu and get the flu shot too.
Another Facebook question, can I keep getting tested even after getting the vaccine?
Yes, I actually get tested regularly because I got the vaccine, but I do work in a pharmacy. I try to socially distance from people, but I'm sort of sociable, and sometimes I forget and I hug people, even though we don't do that anymore. So I actually try to get tested at work every couple weeks just to stay on the safe side.
I work at our CERCL's testing center, and we find that a lot, that people are fully vaccinated and then they return to get tested because the grandbaby came over this week, or I'm going to babysit the grandbaby in 2 weeks or something like that. So they tend to keep coming in, getting tested, or just this one family, just every 3 weeks, they come in, the entire family, and get, tested to make sure that someone hasn't went out there and, got the, got infected, even being fully vaccinated. So we find that quite a bit. Those are the type of people that we're testing.
And I think with the holiday coming, that question is becoming more prevalent. A lot of people are asking me, should I get tested before Thanksgiving, before I go to my grandparents' house? And I actually recommend that they do, but you have to remember, after you get tested, you have to be extremely careful because you could get infected. I would hate to say this. You can get infected after becoming tested. I won't say any number of millions of ways, grocery store, any number of trips, errands you might be running pre-Thanksgiving that could re-expose you. So getting tested is good to know your status of the moment that you're in. And you have to really be cognizant of the type of test you get and where you are in your potential infection cycle. So it's complicated. And sometimes people get a test result that is a false positive or a false negative. It's extremely rare, but that does appear on Facebook, right? And then it's propagated to the rest of the world as if this is a really common risk. It's not really a common risk. It's really just usually a matter of timing and sampling. So you just want to be really careful when you do that you're getting tested at appropriate time and that you're social distancing before you go to anybody who's vulnerable. Hopefully your elders are vaccinated before Thanksgiving so that you're both bubbles of protection.
Jewel, I'm glad that you brought that up about the different testing, because we have some people, we don't do the rapid testing where we are. And a lot of people come in for a rapid test, but I've heard a lot of people getting false results from the rapid testing. What's you guys' thoughts? What's the research or whatever on rapid testing or further testing?
Well, in my opinion, rapid testing is an amazing miracle of modern science, especially the way that you can now get home test kits and you can do COVID tests at home. So just that they brought that technology, they made it affordable, they made it accessible, they made it immediate in this short period of time. I think that's an amazing gift to public health. But the rapid test is best if you have active symptoms. So if you're asymptomatic, you probably don't want to do the rapid test. You want to either feel sick or probably go get the PCR test.
I just want to agree with Dr. Younge. I just remember how difficult it was to get a test for so long. And now they're sitting there in Walgreens right next to the checkout. So that is truly amazing. But I do think for people who are making these decisions about getting a test before going to see their family and they're asymptomatic, the ideal would be to search for a PCR and keep those ones at the retail pharmacies for when you have symptoms.
I also wanted to add that it's also important that these tests are also operator dependent. So it's important to follow the instructions and perform the tests properly, because especially early on in the pandemic, I think a lot of the false negatives that we were seeing were because the test wasn't really being done properly. Not inserting it far enough into the nose and things like that. So I think that's. So I wanted to emphasize that too. That just make sure that you're following the instructions closely and doing the test properly to get the best results.
Miss Gwen, you are on the ground in Maywood. You all are still delivering vaccines, and are you testing or vaccinating?
We're still testing on Wednesdays and Thursdays in Maywood at the rec center for 2 to 4, and on Mondays by appointments. So we're still testing in Maywood at least 3 days a week.
And are you all trying to steer people to get vaccinated as well?
Oh, yes. That's our first question. When they come through the door, they see me. And that's the first question I ask them. So why aren't you vaccinated? And I have to be a little, sweet with the questioning or whatever. I don't want to run someone away. But that question is asked by me, and also is asked in the survey once they get tested. So yes, we're steering them. We give them a list of places to go to get vaccinated. We help them set up an appointment to get vaccinated. So we're doing all that we can to get our neighborhood and everyone vaccinated. So, pretty soon we will go to the grocery store and we will go visit grandma and stuff like that. So, yes, we're still doing that.
Someone asked on Facebook, is it a good idea? I'm sorry, Dr. Bertumen.
I was really quickly. Was curious, Miss Gwen. Are you hearing any common reasons as to why people are not being vaccinated?
Well, it was really. I was glad to hear Dr. Younge and Dr. Blair talk about that temporary vaccine, because we worked. We had vaccines available at the Maywood Fest this year. And there was one gentleman that walked up and said, "Oh no, they said that you should wait 2 years before taking the vaccine once it's approved." Well, right away, I had the lawyer sitting there with me, and I had Dr. Silva sitting there with me. I say, "Okay, guys, I need you guys to address this." Well, Maya, right away, who's Maya Watson, who's our lawyer, she sat there and she looked it up right away. Well, that's during the trial period. So these are the things that you're still, and since that time, I've heard it several times. I've heard Dr. Blair also say that. So I don't know why that's running rapid right now, but it's running rapid right now that they should wait 2 years, for that. And some people have just no explanation. I'm just absolutely not going to take it. Or putting certain things into their body. Oh no, I can't, because it's gonna do this. It's gonna one person told me that, and this is going around, guys, that you're gonna turn into a zombie.
Now,
and when the first time I heard it, I said, "Oh, that's just the kids," but it's not.
Can I ask you, Ms. Gwen, have you heard from the young women about being worried about infertility and pregnancy? Because I hear that a lot. I don't know if any of you.
You know what? I have not heard that. I've heard a couple, not people coming into the center. I haven't heard that. I've heard a couple people mention it, that they've heard that or heard it on news reports or whatever. But I haven't personally got it there in the center about, pregnancies.
I heard it a lot and therefore was really excited when a lot of research came out recently about safety in pregnant women. And the studies actually looked at the outcomes of women who are pregnant and got COVID, and things like preeclampsia, preterm labor, even maternal deaths in this study were 22 times higher in a woman with COVID than not. So I think, the recommendations for getting vaccinated 12 and up now includes pregnant women too. And I just try to talk about how if you do become pregnant, COVID could be so dangerous for you and the baby. And then now there's a lot of studies too that show no increase in miscarriage among women who receive the vaccine. So I think that's important to get it out there.
That feeds into another Facebook question from someone who said they were worried, for people who seem worried about the side effects of the vaccine. They wanted to point out that there are also possible long-term negative effects of COVID, which probably far outweigh whatever perceived effects of vaccine. I wanted to mention Loyola recently opened their new neurology COVID clinic. Does anybody want to talk about that? Because they're studying the long-term effects of COVID at Loyola now.
Yeah, there's a team of neurologists and psychologists looking at long COVID, in particular, the changes to the neurologic system. So nerve damage in terms of the motor system, how you move, and sensory system in terms of feeling different sensations in your body, but also memory changes. Unfortunately, Some with long COVID can have memory changes, depression, mood disorders. I think that the last I saw, the data was that 1 in 7 people who have COVID will have long COVID, which is just defined by 12 weeks of symptoms. So those won't all be neurologic. Many people will have continued cough. Some people's coughs go on quite a long time. So that's the study of the study first of how frequent it is important. I think that neurologists are doing that. And then, what can we do about it? What sort of treatments will we have for the folks that have long COVID?
Someone asked, is it a good idea to mix the different vaccines? For instance, if I received a Johnson & Johnson vaccine, can I get a Moderna booster shot?
Jewel, that's your question.
That's my question. I actually have been reading a lot about this because I also get asked this when I give vaccines. At a recent vaccine fair, somebody wanted to mix her vaccine. She came up to me and asked if she could mix it up because she likes to mix it up. That's literally what she said, because she likes to mix it up. And so I think there's emerging evidence about that. And my answer is, let's wait and see. Right now, in some places, people are getting mixed vaccines, but not because of choice, but because of vaccine shortages. So they have evidence that people have gotten mixed vaccines in some places. And they even loosen the guidance to say that if one is unavailable, you can take a different vaccine for your second shot, but there's no study to demonstrate effectiveness when you mix shots. So for those same people who are feeling like the EUA is not strong enough evidence that the vaccine is safe, those people should be less certain about mixing shots because there's no study to show it. It's almost like, freestyling a cake recipe. It could work out, it could, but it's still chemistry. I mean, at the end of the day, baking a cake is still chemistry. It's still science. You could mix it up and you could ruin it too. So do you want to ruin it on something that's high stakes, like a COVID vaccination? Would you rather do what's proven, what has evidence, what you can track, what you can look for? That would be the only ethical thing for a clinician to suggest you to do, is to do what we've studied and what we know to be proven to have evidence. And if we can't offer you that, that's the best case scenario, then there may be a situation in which you have to mix vaccines. That would be the less positive scenario for now. But keep your eyes open because everything's always changing with COVID guidance. And the CDC is really responsive. So you can always go to the CDC to see what their next recommendation is. They're very conservative. The CDC is not a wild organization that wants to do the newest, most free thing in medicine. So you can trust that if the CDC is saying it, it's backed by a lot of evidence, and you can almost always find the primary evidence right there on the CDC website if you really want to look into it.
Are we toward the end of this pandemic? And do any of you see any concerning strains on the horizon?
Well, I don't know if I should have chimed in first because I think somebody probably has a more direct answer to this question. But in my opinion, the pandemic is not just the coronavirus itself. It's also all of the social consequences that have come from the quarantine. So even now, you're seeing people who have delayed medical care because they were scared to go to hospitals and scared to get treatments. I count those as consequences of the pandemic. So there's all kind of social situations. We see violence rising. We see all this fracture in society. It's going to be a long time before we can heal those things. And that's also something I factor into why it's important to get the vaccine. It's important to come back together as a society so we can move forward together. So in my opinion, the pandemic is not over until we heal in a holistic way from what the coronavirus has done.
I'm going to piggyback off of that. So I'll leave the actual prediction to Dr. Bertumen, but I just can't agree with you more, Dr. Younge, that I learned a word early in the pandemic called, the word is syndemic, which means these sort of other epidemics that start along with an infectious pandemic. And you mentioned, people not taking care of their chronic diseases, because that requires visiting your doctor. It sometimes requires exercise, getting out of your house, eating healthy food. All those things I just said have become difficult. And so what I'm really seeing a lot in my clinic are people who are struggling with their normal illnesses, along with grief. I mean, I think there's a collective grief. There are a lot of individuals and homes that have had unbelievable loss, and the way that grief can take a toll, I think is what will go on for years. But hopefully, the infection itself will have an end. We'll see what Dr. Bertumen thinks.
So, just adding to that conversation, what this pandemic has shown was a couple of things. One is that, you know, uh, about health inequities. I think it really highlighted those, like when it hit us, because, we saw that people, well, were like, this was not something uh, this was not something that was hitting people evenly. We were all at risk, but it was hitting other people, like it was hitting vulnerable populations more than others. I remembered someone said, I think there was a meme that was going around that I thought was pretty clever, which was that we shouldn't really say that we're in the same boat. We're in the same ocean, but we're kind of in different boats. Really, some people are in big ships, other people are in tiny canoes that are easily overcome by the ocean. So yeah, that's one thing that I wanted to mention, was that I did really highlight the inequities of our healthcare system, and about like what we have to do to address those. And it also affects like how the vaccine is being distributed too. So I wanted to kind of add that aspect of that in there. In terms of the question, I'll just say that it's kind of hard to say. I will say that if everybody got the vaccine, the pandemic would be like over like sooner rather than later. I would say that, because I'm not sure about any of you, but it was frustrating, because right around May or June, it seemed like, okay, we finally have the light at the end of the tunnel. And I remembered in July, like I was actually going like into public for the first time without a mask, and it felt like so good. And then suddenly the Delta virus came, or so suddenly the Delta variant reared its ugly head, and then people were kind of reverting back, like doing like the mask mandates and all that. And you know we were just, it was just kind of frustrating. So it's hard to tell at this point, because the reason why we are recommending the vaccine is because we want to put an end to like actually put like an end to the virus. And as long as there's still circulating virus, there's still the possibility of mutation happening in those viruses. And when there's possibility of mutation, there's a possibility of a variant that is different from what we're used to. And that's exactly what happened with the Delta variant. So that's the concern, is that if we're not if not everybody's doing their part to kind of squash the pandemic, then there's still the possibility of other things popping up. So in terms of like variants that I'm seeing coming, you saw the list of variants that are being monitored at this point, but nothing is, as far as I know, nothing is kind of popping up as a big as a huge cause of infections at this point, other than the Delta variant. But never say never, So that's kind of my 2 cents about that particular scenario. So.
And I think that's a really good point, first of all, about us, the ocean and the uneven distribution, because we could say something very similar about HIV. Why is HIV so rampant still in some communities, and all but a historical matter in other communities? And you could say the same thing about polio. In the United States, you never see polio. Wilma Rudolph is the last famous person with polio in the United States, right? But in other countries, polio still exists. It's still active in those countries. And I don't find it surprising that the same things they say about the COVID vaccine are the same things that prevented people from getting the polio vaccine. The exact same things, except for maybe 5G. But I'm sure there was some sort of technological innovation at that time relative to like the 5G that people pointed to as well. So these things aren't because of COVID. These things are the myths that continue to populate in the population. but certainly measles has made a return in the United States
Yeah.
recently. And that is very frightening because the measles Delta variant is, as from my understanding, as infectious as chickenpox. And anybody who remembers the school days of chickenpox remembers how frighteningly effective chickenpox was.
Mhm.
One kid had it, the class had it.
Mhm.
Stop. That was it. And measles is more infectious than chickenpox.
Yes.
So I know it's hard for people to deal with vaccines, but I feel like a vaccine is a privilege.
Mhm.
Privilege to be able to get a vaccine because there are a lot of people who wish that they could get these vaccines. So when I have the opportunity, I take it. And there's a risk to every medication. And so I know that there's that risk and I have had side effects. I'm going to wrestle with that risk. But I have a public health responsibility. I don't want to be a purveyor of measles or polio or COVID, right? So I have that responsibility to my community. But then I have responsibility to myself.
Mhm.
Because if I don't take care of myself, then how am I going to take care of anybody else?
Mhm.
So those are the things that I have to put in the benefits category. And I have to compare all those huge things to the fact that I could have to take Tylenol for 3 days straight.
Michael, I know that we're getting ready to close down soon, but there was one question that came from our audience that I didn't see was answered. If someone has an extreme side effect that can cause death, can an individual hold their company liable for being forced to get the vaccine? Medically, can someone be covered?
I don't know the answer.
Anyone?
I was gonna
Our
say
lawyers are not on here tonight, so
that's kind of
I
a
don't
legal
know.
that's kind of a legal question. I'm not sure.
It is, but I've been present in legal conversations about this question. So I can tell you that that answer is officially, it is not known. It will take a legal case to resolve that answer, quite honestly. I think it becomes less and less likely because, all myth aside, the COVID vaccine is extremely safe. It is extremely safe. So if you take that to court, you're going to have a hard case against the COVID vaccine. It is documented, it's safe over and over and over again. It is probably more safe than Tylenol. That's how safe the COVID vaccine is. So I think you may lose that case because you may not have the evidence to prove that the company forced you to do something that was dangerous. But, there are some amazing lawyers out here. And I don't know what the downstream effect would be if that case were won. That's also something that they weigh a lot in court. If this case goes forward and this person wins, what does it do for the other millions of people who may be in a similar situation? So I don't know the answer. I don't think anybody knows the answer. I'm interested to see that answer. But if I were a betting person, which I am not, I would bet on that's not a winning lawsuit. Because
I think it's
really
probably
safe. That's just the truth.
probably important to mention that this is not the only vaccine mandate either that we've had. So I wanted to end with one final sort of question, and I hate to bring doom and gloom into this, but I've read a few things this week about the potential of another pandemic, which a lot of public health experts are, they're bracing for. There was a story in the Atlantic, and I'll just read one sentence that said that today's actions are already writing the opening chapters of the next pandemic's history. And there was a study from the Center for Global Development where some researchers estimated that the annual probability of a pandemic on the scale of COVID-19 in any given year to be between 2.5% and 3.3%, which means a 47 to 57% chance of another global pandemic as deadly as COVID in the next 25 years. From you all standpoint and vantage point as public health experts, Are you all confident that we are prepared for what could very well be another pandemic or a series of pandemics? Because I think they're going to be more frequent than we probably imagine.
No, we are not. The Asian model and why so many countries in Asia have been successful is because they've faced a lot more respiratory pandemics. China, I believe, had one mega city. They tested 11 million people in the course of one weekend because there was one case. We're really not at that level here in the United States. And as Dr. Bertumen was saying, we have such an unequal response as a health system that's going to be the crux of us ever figuring out how to do better next time. But the playbook for how to handle a pandemic was already written. We just didn't follow it. So maybe we should all start just making sure to make addition to.
Anyone else? Well, I appreciate you all doing this. Thank you for giving over your time and energy and your thought to informing our community. I really appreciate it. Dr. Silva, do you want to say some parting words?
No, thank you. I hid in the background just listening to these wise experts. I really want to thank them. I've always learned a lot when I hear from my experts, and thank you for those messages and clarifying some aspects. So thank you for that, and thank you, Village Free Press, for helping us put this together and hosting us so graciously.
Thank you.
Thank you. Have a good night, everybody.
You too.
Thank you.
Everybody stay safe.
Bye-bye.